move to the back of the patient where I'm going to palpate the thyroid gland. I need you to bend your head slightly forward and a little bit to the right. I'm going to try to, a little bit like that. I'm trying to push your thyroid gland with my left hand and palpate with my right. I'm now inspecting the posterior chest for skin characteristics, symmetry, shoulders, and your muscles. I'm going to palpate to confirm symmetrical chest expansion. I'm going to put my thumbs at T9. And can you take a deep breath for me? Okay, good. I'm now going to palpate to detect tactile primitive. And I'm going to ask you to repeat the word 99 for me.
99.
Again.
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 99.
Okay, good. I'm going to palpate down the spine to assess the spinous processes. And now I'm going to percuss the posterior and lateral lung fields. While I'm back here, I'm also going to percuss the kidneys at the 12th rib at the costovertebral angle. Let me know if you feel any pain or tenderness. No pain?
No.
No pain?
No.
I'm now going to auscultate the breath sounds. So take a deep breath for me. Again. 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 One more time. Now that I'm back facing the front of the patient, I'm going to inspect the anterior lungs. And I'm going to auscultate the upper lobes. Deep breath. Deep breath. So now I'm going to test range of motion and muscle strength of the upper extremities. I need you to move your arms forward and out like this. Good. And come down. I need you to reach behind your back and put it like this. Okay, good. I need you to raise your arms above your head and touch your palms together. Okay, good. I need you to reach behind your head and place your hands behind your head. Okay, good. I need you to bend and straighten each elbow. Okay, good. And now try to do it against my resistance. Try to bend it. Palpate each of your finger joints. I need you to put your hand flat like that, and then back up, and now try to turn your palm right down like that. Do the same with this one. spread your fingers apart, put them in. You can make a fist for me. You need to touch each finger to your thumb. And now I need you to touch your finger to your nose and then touch my finger. Very good. And do your other hand. Good. I'm now going to test your sense of position. I need you to close your eyes for me and let me know which way I move your finger, up or down.
Up.
Okay, good. I'm now going to put an object in your hand. Close your eyes. And I need to see if you can identify what it is.
Feet.
Yes. Now keep your eyes closed. And I'm going to draw a number on your hand. And I need you to let me know what number I'm drawing.
Not sure. 6.
Okay, good. I'm going to check the capillary refill in your fingers. Palpate your radial pulses. And I'm going to palpate your epitrochlear lymph nodes. Okay, good. Now I'm going to ask you to lay back on the exam table. Okay, now that I have you lying in a supine position, I'm going to examine your neck vessels, inspecting your jugular veins, and looking for any pulsations. I'm now going to first inspect the precordium for any abnormal pulsations or keys. I'm now going to palpate the apical impulse, which is at the 5th intercostal space at the mid-clavicular line. I'm now going to auscultate the apical pulse. The rate is 62 beats a minute. I'm now going to auscultate S1 and S2. S1 at the apex. S2 at the base. I'm now going to auscultate the aortic valve in the second right intercostal space, the pulmonic valve at the second left intercostal space, the tricuspid valve at the left lower sternal border, and the mitral valve at the 5th intercostal space, left midclavicular.